Okay, we have some of our group is meeting to do some work for later this morning, and so I'm sorry for the delay, and I didn't mean to not reward you all for being here. Um, um, so thank you all for coming back, and good morning to those of you who are watching on the web. We have a busy half day today, as you probably can see from your agenda, and we will have some chance to talk with everybody a little bit later this morning and get some of your thoughts that are still dangling. It is important to note that if something doesn't get said here at the workshop, it won't make it into our summary. So if you have anything really brilliant to tell us, be sure to say it so we can capture it. So yesterday we heard, we organized yesterday to focus on how to sustain funding for programs and services that promote children's behavioral health and how to support innovations. We're going to wind our way back to that later this morning, but we're first going to indulge ourselves in a couple of research presentations. Once again, we're going to pay some special attention to primary care because we see that as an opportunity that's, you know, kind of emerging right as we speak, and the horse is out of the barn, and we need to pay some special attention to how to maximize opportunities there to promote children's behavioral health. So we're going to have some very exciting research presentations to start us off this morning, and then we're going to break into 3 small groups and do some of the kind of heavy lifting that we've come to value in these workshops. Again, you'll probably notice that the 3 groups are overlap in their emphasis. There's a chart that staff has. You probably received it when you went by the table this morning. If you didn't, they're passing them out again. Some of you will have been assigned to a small group or expressed interest in it. If you didn't and your name doesn't appear anywhere, you just get to go wherever you want. And you will have a chance to talk again when the small groups report back to this larger group. You'll have an opportunity to weigh in on some thoughts you might have to add to those reports. So it isn't that you won't have any other opportunity to contribute to the other groups, but you will need to devote yourself to one of them so that you can participate fully. And again, those groups, one of them will focus on where the forum should go, where else we might devote some of our strategic effort. A second one, which of course is related, but it's going to be, you know, organized a little bit differently, is coordinating a research and service agenda. And then the third one is about a strategic initiative we've already committed to, which is about moving evidence-based parenting programs into primary care settings. Again, if we could ask of you to focus on actionable suggestions. It's very hard. It's hard for all of us, and it's we know that we're asking a lot of you, but don't be shy about giving us some suggestions or raising suggestions for how we as a larger stakeholder group can collaborate on some very specific actions. Okay, we'll have a lot more chance to sort of discuss some of the issues that were raised yesterday and some of the things that will be highlighted this morning by our presenters. Does anybody have anything they want to just raise or ask before we get started with our morning? No, you're all just bright-eyed and bushy-tailed and ready to go, huh? Okay, then I'm going to turn this over to Hendrix Brown, who's going to lead our morning session.